talking about the left coronary artery. The coronary circulation is responsible for nourishing the heart during its tireless effort in pumping blood around the body. The first branches that radiate from the ascending aorta as it emerges from the left ventricle are the left and right coronary arteries, which directly provide an arterial blood supply to the cardiac muscle. As just mentioned, the focus of this tutorial is the left coronary artery, which you can see highlighted in green on this image of the anterior view of the heart. The left coronary artery, along with the right, arises from the bilateral aortic sinuses, which are situated just distal to the aortic valve and runs between the left atrium and the trunk of the pulmonary artery. It supplies the left atrium, a large portion of the left ventricle, a small portion of the right ventricle, the interventricular septum, and the sinoatrial node in approximately 40% of the population. Its two main branches consist of the circumflex branch that supplies the posterior surface of the heart by running on its left side within the atrioventricular groove. The anterior interventricular branch, which runs inferiorly down the interventricular groove to the cardiac apex, where it anastomoses with the posterior interventricular artery.